Thank you, Michelle, for taking us through the first segment, which was your first symptoms, your diagnosis, and then the last segment, segment 2, which was your first line treatment. Now for this segment, we're covering the relapse, and I'm so sorry you had to go through that. I know it's, I mean, I just want to ask you about that experience because, having to go through it the first time and then again, I'm sure it was just so hard hitting. And then, of course, your second line treatment. But bring us back to that time. So you finished your stem cell transplant in September of 2018. You left October, the hospital, and you were good, getting your checkups through 2019. All is, well. And then in 2020, around August, you said you started to notice a swollen lymph node. Is that what it was?
Yes. So pretty much I like going through treatment, you're very in tune with your body and you know when something is wrong. So I had like a swollen lymph node on my neck. It was like you couldn't even, like, you see the jawline, you couldn't even see the jawline. And I was obviously, sometimes I get like paranoid with just if I notice something different. So I was like, oh, I'll make an appointment with my doctor. So I went in to make an to the hospital, and then they were keeping me like a little longer, and I was like, I'm so confused. I remember sitting in a room and they did my labs, obviously. And then I kind of just was like, I remember being there and being like, what? I think something is really wrong. Like, I don't know. So then I thought it was just going to be a 30-minute appointment, ended up getting hospitalized. Called my parents immediately. They didn't know what was wrong. They just saw that my counts were off. I forget exactly what like they thought it was. I think I don't know what kind of sickness they thought I was. But I was in the hospital for a couple days, I think 2 or 3. And then I remember not my normal doctor came up, and I think my normal doctor's on vacation, but a doctor came up and he was like, oh yeah, so you're going to get transferred to Yale. And I was like, wait, why? And then he was like, oh, you relapsed. And I was like, wait, what? Like, yeah, it was just, I was like, oh my God. Like, I thought it was just like sick. Like, I kind of had a feeling, but like not at all. And then this part emotionally, like, oh, it hit hard because as I was saying before, I did obviously like research into it, or just like understanding my medical condition, taking notes. And I just didn't think you could relapse after a transplant. Like, I thought it was like 99% effective. I don't know where I was getting that statistic from, but I thought it was effective. So it hit hard. And I remember I didn't even want to tell my friends. Like, we were like making plans and I was like, oh, I'm fine. Because I was like, this isn't real. Like, they didn't do a bone marrow biopsy. How can they see it? But I guess they had, like, with the lab work, they had scans where they could see it. But so that was just my lack of understanding there. And then when I got transferred to Yale, I was like, oh, it's back. I didn't want it to be real, obviously. And I didn't think it was real. So that definitely hit me hard. Yeah. And I remember too, also, I know you're not supposed to Google diagnoses, but that's what I did some Googling. Well, probably the first time as well. I did some Googling, but just like affirmation for myself.
I know it's the thing that we're not supposed to do, but like, and I think I didn't in the beginning. And then I remember part of my diagnosis, like I was in kind of denial. There was something called double expressor, like an overexpression of protein or something, yada, yada. But basically all I heard was, this is not as good as if you didn't have it. And it took me a while, but I remember Googling it randomly one day, and then starting to bawl. And it's like, that you just don't want to, you don't want to, but
Mhm.
sometimes you just can't help yourself.
Yeah,
It sounds like you had a different experience where you thought, well, the transplant, we're good. So I'm wondering how that really hit you. You said it was really hard, but how were you able to, I guess, like move through that one, because it was different
yeah.
from the first one?
Didn't believe it at all. I was like, "No, I'm denial, denial." But then becoming more accustomed with it, it also like I got sent back to Yale, so my regular doctor, just kind of touching base and asking those like tougher questions. Like I just don't understand. And then just talking about, oh, it has your obviously I'm not the only one, but I was like, is this only like 10 people have this or what's and getting more realistic approach and understanding of, oh, this does happen. And then as I mentioned before with the genetic mutation that I had, that's part of the reason why I relapsed. And another part too is um sometimes you have a perfect match, but it can be too perfect. And I just didn't understand those concepts at first. And having those explained um, helped me understand more and helped me cope with what was going on. So for me, just like the knowledge of it, because I'm very in tune with what was going on and having that explained helped me understand it more. And just also having like my family again be super supportive and like my friends and just being more accustomed with what is my condition too. And obviously it was tough, but that mental just strength, um, and it's so hard to have. And there's ways that have helped me enhance it. For example, as we were talking about like hobbies before too, or what you do in the hospital, I very much like still appreciate like meditation as a huge aspect that I haven't mentioned, but that's helped me just emotionally center myself. And I did it in the hospital almost every day, but having that just like spiritual kind of connection with yourself is definitely like you don't have to talk to anyone, but like emotionally, it's helping you reset from what is going on in your life and just, yeah, keep it all out.
I think meditation's great, and you're going inward and you can do it on your own. So thank you for bringing that up. For your relapse treatment, without going into the details, how did your oncologist, hematologist say, describe the regimen? So it was chemo again, the chemo pill first, and then the stem cell transplant, or what was the order?
High level, I forget the exact name of the regimen, but it was a more intensive chemo for the first round of my relapse. So I was in the hospital for a month, um, and then I went home for a month, and then I went back to the hospital for a month for my transplant. A couple days, I think like 2 weeks before my transplant, I started the chemo pill. But on, when I, it's also all of a sudden, like things happen so quickly, like you do the lab work and then you're ready. So I was on the chemo pill for I think only a week, and then they were like, "Oh, you're ready to for the transplant." So I went in for the transplant and I stopped the chemo pill. Um, Pretty much the chemo pill from their description, there's obviously like different forms of it. You're on it for like could be a year, maybe 2 years. So I was on pause. I Yeah, on pause for a little, and I actually just restarted it like a week or two ago. So yeah, those are kind of just the timeline. And then so it was August 2020 when I had my first round, went home for a month, and then October 30th was my second transplant.
By the way, it is a targeted therapy, so technically not chemotherapy, but it is an oral drug. I do want to ask about the stem cell transplant. It was the second one. I know it was your father, and that was a half match. So, what was different about this stem cell transplant?
So as I mentioned before, sometimes with a perfect match, it can be too perfect. So they kind of, the first time too, they swapped both my parents as well. So my dad was a half match. So that's kind of the science behind it too, high level, like half, yeah, the chromosomes match up. But not to get into that. So the treatment plan for half matches are a little different. So I had, and obviously every person is different as well, but I had, I think, 4 days of chemo and then some radiation, not as intensive as if you're having a tumor. So that part was definitely new for me, because when I'm going over the paperwork and I saw the a radiologist call me, and I was like, I didn't know I was getting radiation, even though I'm meeting with my stem cell doctor. It's just, I'm not used to it, but he was used to, that's how half matches go. So that was definitely a shock, because you always hear stuff about radiation. And then a day of rest, and then I had my transplant. So the regimen a little different. And then just going forward, side effects wise, I would say I obviously still had the same symptoms. I mentioned before too, like when I left the hospital, I just so weak I couldn't walk. But the first time, I think it affected my stomach and my appetite so much more, because I lost weight, but not as much as the first time. So
And I do want to ask about the radiation. I know you said it's lighter than, say, for people who are radiating maybe like a solid mass or something, but
yeah.
what was that like? And any tips
Mhm.
for people who are going through the same kind of radiation?
Yeah. So I had full body radiation because obviously the blood flows throughout. But if if someone with like a tumor, it would just be that area. Um, and yeah, as I said before, obviously you hear the stories and it sounds super scary, but pretty much they just measured my body, and then later on I went into this room, and it's a huge room. I think in my mind it was like, oh, it's like a closet size, like looks like a dungeon, but it's not, like, it's not scary at all. It's this huge hospital room, and you're just like laying there and a light shining on you. So it's really not that bad. I think just the mental thought of it is so much worse than it actually is. And you just lay there, and then I forgot how long it took. I think it was like an hour or something, but and then I flipped sides and everything, but it's not as bad as people come off. Obviously there's different grades, and I got a lighter dose, but it's not as bad as like people.
Okay, so that's good to know. I think, yeah, people get a little worried, of course. You
Yeah.
think of radiation. And I would love to now talk about the XOSPATA, and it's the name is gilteritinib or something,
Yeah.
gilteritinib.
I think you
Gosh,
said that right, actually.
no, I butchered that. I think I got it right the second time. But I've been talking to other people saying, who comes up with these names? Like, can
I
we
know.
can we make them less daunting? But so what I found really fascinating, I wasn't familiar with that drug at all. Again, a targeted therapy, TKI. But then I saw that the FDA had approved it for, again, so relapse refractory AML patients with the genetic mutation that you have,
Mhm.
FLT3, right? FLT3,
Yeah.
so FLT3. And apparently something like 25 to 30% of AML patients have that genetic
Yeah.
mutation. And so they approved it in November of 2018. So it was like right after you had finished your treatment the first time around.
Mhm.
And then they came up with this. And I'm so glad that they did, because
Mhm.
then it was there in time for you. So please describe this targeted therapy drug, how often you're taking it and what it's been like.
So I actually do remember when I first was diagnosed, they were talking about if we have like three, then we'll have to go down this road. But the first time I didn't have it. Um, and then when I, like, after the transplant, in order for it to stay alive, as I said, it developed. Um, but pretty much I was on it in October 2020 for only a week, and then I had transplant, so they didn't want to combine it. And then I got back on it in March, end of March, after I got off immunosuppressants. So just in general, that I was recovering from my transplant, and it takes a long time for the body to recover. So they didn't want to like mix medications. I was just tired. I'd started work too, which I think we'll get into later, but so I couldn't tell if it was because of the transplant. I had 2 transplants, which obviously affects your body vastly. But I was also tired from the pill. But then they took a pause on it. So now I just restarted again, fast forward to August. And I'm on it. I just upped the dose actually last week. So now I'm at normal amount. And I've been doing no crazy side effects yet. They're still doing my blood work too. So my like creatinine was a little high. So that was the big concern. So we'll see also in the future, like how I do with it, deal with it. But another big part of it too is I have an EKG once a week just to monitor the heart because I think a big part of it is just pure heart racing or like seizures or possible like fainting too. So that's just a concern, but nothing on it now. So that's good.
So I hear that there's just a lot of monitoring that has to go
Yes.
on.
Mhm.
And then I'm also hearing it's mostly fatigue, mostly
Yeah.
fatigue. There's some nausea, but but not as bad as when you were on the IV chemo. Um, but other than that, it's been pretty good.
Yes. Mhm. Yeah.
Okay, that's really good to know. And I wonder too about, and you said this with the Lovenox, which by the way, I also had to do, and they are definitely not fun. Ugh,
Yeah.
shots in the tummy by yourself. No, thank you.
Yeah.
Um, but it's like being able to switch from Lovenox to a pill, being able to go from an IV chemo to a pill. What's the impact of being able to not be in the hospital and to be able to like be at home and yeah, like it's like taking another kind of medicine, right?
It's honestly like it's so nice to be home. You're in your own bed. You're not getting woken up all the time. Like being able to, it's crazy just the research and technology with like the adaptations and how granular and detailed they can get. The medicine is just amazing and incredible, and it's still improving. Like you said, I didn't even realize it was that soon that the FDA regulated that, or like the cryopreservation surgery. Like I'm sure there are very much faster development now. But being at home is just so nice. Like a huge part for me was my parents having to travel to the hospital, which is so far away, and it gives them ease. And they're working, both of them. So like just helps like manage their schedule, gives me peace of mind. And then just being able to do it myself is so nice. Another big thing with MRSA, actually, it's 6 weeks of vancomycin, which is through an IV. So I was able to treat myself with an IV at home, which is amazing, not having to spend all the time going down to the hospital. It's just so many hours you're saving, and they would send the medication straight to my house. I can fridge it. It's so nice having that aspect. And even I noticed from my first treatment to second, they sent me like a pull with a bag, but the second one, it was like a ball almost. I could keep in my pocket, and like it was pressurized so it would go straight. So it's like continually adapting, and it makes it just so much easier for the patient.
this this is an area that I think so many of us are excited about, whether it's the technology of the vessel that we're getting our treatment in. So going from a pole and a bag to a little ball, or those are the quality of life impacts. And I think people are starting to and have been starting to listen to patients more, which is really, really important. That's the quality of life is so important to us, right? And then of course the extending life, and giving more options with treatment and more targeted therapy, more precision there, medicine, and being like, oh, hey, Michelle has FLT3, here you go. This is going to
Mm.
directly address this part of the situation. So really appreciate you sharing that. And um, I'm sure that this will help a lot of people out there wondering about what the options are. And coming up next, our final segment with you, Michele, will be about, living life, quality of life after a cancer diagnosis. We'll cover hair loss and working and being a young cancer patient, fertility preservation, so many different things. So that's coming up in segment 4 of Michele's story.